they do the scaling and it sounds so much. They do root canal and they give us injections, anesthesia or something, and it's so painful, when they do root canal. you know they clean up, and when they clean up, it's just so painful. Even the scaling or everything, they always say something like that. They always think no, think that all they say is that dentists are, dangerous. I mean, you can have a good teeth, um, and that that gives you confidence. You can see some YouTube videos that people had depression or something. They didn't brush their teeth, and then they went to the dentist. The dentist fixed their teeth, cleaned them up and everything, and now they're so confident they can show up and talk to the people. They can socialize again. And also, sometimes they forgot about maxillomandibular injuries. Anyway, I'm talking about the patient and the people in general. And what should I say? Yeah, I guess we're just heroes who are not acknowledged yet. But I heard from seniors that people are changing day by day. I hope that is true, and I just hope that whatever I faced, I hope my juniors don't face them. That's all I want, to be honest. And even if you see some YouTube contents, there are so less content of dentistry in YouTube. It makes you sad. Like if you type MBBS, there will be tons of contents, and if you type dentistry, there will be less of contents. It can sometimes frustrate you. Even the views are less in the dentistry videos and post. But I just I'm just hoping for the best day, to be honest, because no matter how people overlook it, I know what it is, and I think it's just beautiful. It's a beautiful sector. There are so many things that you can really witness in being in dentistry. I never thought I can witness them. If I wasn't a BDS, if I wasn't a dental student, I would have never experienced the whole different world of dentistry. I'm just glad, I'm just glad. Alhamdulillah for everything. Alhamdulillah. Well, now I'm thinking that I should make some contents of biochemistry, physiology, general anatomy, and especially on STM and dental anatomy. I'm thinking of taking some classes, and this time I'm really thinking, hopefully, if Allah bless me, I'm thinking to do practical videos of STM in the YouTube channel, because I think this is the one thing that I have faced so many problems, and yeah, and I just want to say how to do, what to do, so that's it. Maybe I will say something. If you're a student of SOMC and you are from BDS, and if your batch teacher is someone who speaks very fast, I'm not going to say his name. He's very respected and he teaches us very amazing. If you're a student of SOMC, so if you want to do good in the physiology item exams, then all you have to do is you have to record the classes. First of all, you have to sit in the first bench, and then you are going to in SOMC, blueprint is really used. It's a guide. So what the sir is going to say or teach you, you have to mark them in the what you say, in the blueprint. Then you're gonna go to home, and then you're going to hear the record again, and then you're going to see the card picks, and then you are going to mark them again. And also in the record, when you are going to listen to it, you have to know how the sir is talking, and how the sir is answering a question. That's how you are going to answer in the item exams. That's the technique you can also follow about biochemistry. Some people speak fast and some people don't. So our physiology best teacher speaks fast, but he is an amazing teacher. He can teach you very very well. If I talk about his teaching sector, the same method you're going to follow for biochemistry. In general anatomy, you have to touch the viscera, and you have to study the Endeavour Guide. What are you going to study? You are going to study the thing that your best teacher is going to tell you, previous card exam questions. Also, you're going to watch some online YouTube videos. We Like Anatomy is the best. And for biochemistry and physiology, White Apron video is the best, and In General video is the best. Okay, fine. Then, what do you say? Then and for the viscera, you are going to watch Tani Apu video. Okay. Also, for dental anatomy and STM, there are some good YouTube channels. Mental Dental, Easy Dentistry, Dr. Teeth. They're good channels. You can follow them. Please write it down in the notes. Okay. And for first year student, Vishram Singh and A.K. Dotto or B.D. Churashi. These are the 3 books you can follow for general anatomy. For dental anatomy, 10 Kates, then Orup Kedash. And for STM, if you're an SMC student, definitely Roshan Akhtar. Then you can follow Philip, because it is studied worldwide. And for physiology, basically Guyton. Don't buy it. Nobody ever studied it. And for biochemistry, it's ABC. And if you want to know more, then Chatto Narayan, because you are an SMC student. If you're an SMC student, then Chatto Narayan book, you should buy that. But ABC book is definitely the one. Yeah, and also you have to practice making plaster. Making hard plaster. Hard model, and you have to mix the alginate properly. You have to practice it. The motion of 8. Motion of 8. Also like that. Anyway. And what? And in the Instagram, you can follow many dental related videos. It's amazing. It feels amazing. You can do this. And obviously you have to speak to your immediate senior, at least 2 to 3. They're going to say so much. You're going to have very good guidelines on how to study for card exam, item exam, term exam. For card exam, for card written, you have to solve previous card questions, and for Viva, you have to study what you have studied for items, and you have to study more. Okay, so in that time you can ask your MBBS correspondent batchmates that what extra should I study, because MBBS teachers will be in your card final Viva board in general anatomy, physiology and biochemistry. Only in dental anatomy and SDM you are going to give final card final Viva or term final Viva to a dentist. from your college, and in the prof there will be external and internal. And okay, fine. Yeah, pretty much that's it. And you can collect questions, and you should collect questions of previous years, whether it is term, card, or prof. Pretty much that's it. And in the first year, when the college will end, please go home as fast as possible. And a simple advice, the people you thought that you're going to be old with as a friend, the people you never thought gonna leave you will leave you, and the people you thought will be your forever friend will not be your forever friend. There will be times like that. There will be unexpected goodbyes from people. Your expectations will get hurt. People will mistreat you. People will not treat you like human. There will be times like that. I just want to say that I'm still going, alhamdulillah, and I still hope that I will go. So I just want to say that keep faith and keep hope in Allah. That's the best thing you can do to yourself. And don't expect too much, because you're going to get hurt. There's no way you can be happy all the time. So you will get hurt, and you should be mentally prepared for it. And there will be time that there will be so much to do, so pressure, so exams. There will be no social life. There will be this and that problem. But I just want to say, you will mess up. You will fail. Even in the exams or even in your academics, you will fall. There will be some relationship issues as well. People have faced it and will be facing it, or facing right now, who knows. You are adult now and you will be facing such stuff. I'm just going to say it's just life. And I just want to say that you should also focus on some other stuff. Like, I am really interested in business, and I'm really interested in learning new things. Anything that excites me, I learn about it until I'm satisfied. Or you can learn about world politics. You should know about world politics, like what's happening in Palestine, what's happening in Yemen, what's happening in Libya, Lebanon, what's happening in Kashmir, what's happening in India, Sri Lanka, what's happening in Myanmar, because you have to know about India and Myanmar, because you are a Bangladeshi and they are your neighbors. If you are a Bangladeshi, you should know, or at least try to know. You also should know about Syria. You should know about Iran. You should know about America. You should know about you should know about the creepy IDFs. You should know about stuff like that. You should. And also you should try to earn. And also you are going to face discrimination, or you have to sacrifice tuitions for your study. That's also going to happen. Yeah. And there will be sleep deprivation. So many times you're going to face insomnia. You're going to face so stressful nights, or you're going to feel so overwhelmed, so angry, so frustrated, that sometimes you have to take pills like Endeavor 10 for like stress relieving. Many medical and dental students in Bangladesh use the pills. So, and there is also dark side. Some people do drugs and alcohol because of stress in medical and dental life. So I'm going to say, don't do it. Just don't do it. Not worth it. Not worth it. Not worth it. Don't do it. And yeah, that's it. And who genuinely cares for you, take care of them. Call them or tell them that you love them. It will be worth it. Today, whatever I'm saying, it's a message to myself, and it's a reminder to myself as well. I never wanted to say so many things, but today I'm just in the correct mood to say, or let it all out from me. Also, there will be very, very bad batchmates. You know, the negativity is too much in medical and dental life, so it's very common. And I just want to say, if you're a woman, focus on study. Don't get into a relationship because it's a distraction. You know, someone told me that whether you do it or not do it, sorry, whether you are in a good relationship or whether you are in a toxic relationship, the thing that it will cost, it's your time. So don't do it. Okay, at least try not to. Try to have self-control, like my elder sister said to me. Yeah, that's it. um, priority Prioritize your family. I'm trying to do that. I'm really bad at it, but I'm trying to do it. And not your friends. First family, then friends. Because trust me, no matter how bad your relationship with your family is, they're the one who are going to support you when you will be facing a financial problem and you are going to ask a friend to lend money. Sometimes you will just know how monster are your so-called friends are, because their behavior changed and everything. They became rude out of nowhere because the money came in the topic. But your family will not do it, and even if they do it, they will never insult you for it. Even though there will be some exceptions. And if you face some exceptions, then I'm going to say, just try to move out, try to complete your BDS degree and go to abroad, because freedom is very important. Because if you don't get freedom for such a long time, you just become angry. Everything hurts. That's the thing. And also, you should try to be fluent in English, because it's Bangladesh. It's Bangladesh. People think you are so educated if you speak English, and it is really important, because impression is a very it's a key to connection, networking, communication. So if you want to grab attention, or anything, you should speak English. But right now I'm not speaking English because I'm trying to get your attention. It's just me speaking to myself, sort of, you can say. Maybe I want to look back after a few years, or after a few months, or after a few days, what I felt that day. Maybe it's like a video note to myself. It's very amazing. That's all I'm gonna say. We're going to mess up. We're going to mess up very badly, but I'm just going to say it's going to be okay. And please, 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 try not to be selfish. There are so many unkind people in this world, so many bad people in this world. Please try to be kind. At least try. No matter if you fail or not, do you have anger issues or not, at least try. God is watching. And God never play unfairness. It's the human beings. And try not to harm yourself. Don't do any self-harm. And try to love yourself. Try to love yourself, and try not to share your stuff, because share your emotional stuff to people. You can talk with ChatGPT though, in details. At least he don't judge. He sees you for you. But if you ask people or your friends or your batchmate, all they're gonna say, "Oh, you are doing so much extra. It's nothing. You should not do it. You should not think about it so much." No, bro. They don't understand that you are hurting. Sometimes the close people can make you feel miserable. So and also, you don't know when the relationship will get sore. So don't do it. Don't do it. Don't overshare, and don't force yourself to do it, a thing that you actually don't like, unless you have to and have to do it. And I'm going to say that please love yourself. You are not responsible for the things that happens to you, but you are responsible the way you react on it. I think that's really important for people. And yeah, I don't know what else to say. I just want to say, have a good life, have a good day, bye bye, and pray for me if you watch till the end. Bye bye.